story of how Jay Wolkoff came to the Valley is familiar to many who came here from other places. He visited Gunnison on a fall weekend in 1973 and was practicing medicine on Main Street the very next year. Jay didn't plan on becoming a mountain town doctor out west.
I pulled into Gunnison on a cold December evening, December 5th, 1973. Started practice December 10th. And my first 2 months in practice, I was praying for some help. We were seeing, one day we saw 139 patients in our office amongst the three of us. So I was delighted when Jay Wolkoff showed up in town to help bear the burden. Jay has served the community faithfully, productively, and with dedication and passion for almost 40 years. He has delivered more babies than almost anybody can count. He has played a role in the birth, the growth, the development, and ultimately the passing of numerous Gunnison citizens, and has served faithfully with stamina and dedication.
We came here early one morning and didn't call the hospital or nothing, just showed up. It might have been 2 in the morning or something. It was right down the hallway there in that little delivery room, and it had those little shades on there, and oh, it was getting a little testy for me, and we just had one nurse there helping, and she said, Dr. Wolkoff will be in shortly, and I was just kept looking around, and Lisa's going, when is he gonna get here? And then sure enough, the light showed up on the back of the blinds there in that room, and she goes, well, I think that's Dr. Wolkoff. And he came strolling in, and he just as calm as he always is. And Jay goes, well, good morning, everybody. And Lisa's in there just getting, she's quite nervous, and so am I. And, he goes, well, let me take a look here. Oh, beautiful. We're going to have a little baby here real fast. And I mean, it didn't take seconds, or it seemed like it, but probably not to Lisa, and Jay had just popped out with little Bradley and goes, congratulations, you guys have a beautiful baby girl. And we still have the pictures of him, with his arms like this, just as usual, with a big smile on his face, and he goes, well, just as normal as can be. I'm very, very, very comfortable with this. So then, when he puts you nice and calm like that, you feel good. Well, number 2 was a little bit different. That was Kendall, and that was very shortly thereafter. And he told us to be careful about, let's wait a little bit, and we didn't listen. And sure enough, he goes, well, that book that you have, we need to pay attention on one of the chapters in there, because Lisa's probably got placenta priv, and there could be some complications down the road. And so we went, down to the office all the time, on routine checkups and all. And Jay kept telling me, watch that book, watch the chapter, let's pay attention.
My girlfriend and I had decided to elope. And at the time we were living in Denver, and we had set up our wedding with a judge and a photographer, and we were getting married on the south rim of the Black Canyon of the Gunnison. And we had left Denver and decided to ski at Monarch, and happened to be March 31, 1994 was the day. And my wife, on our very first run, took a tumble and blew out her knee. And we ended up in the emergency room here in Gunnison a couple hours later. It was probably about 1 o'clock in the afternoon, and Jay was the ER doc on duty that day. And by that time, my wife's knee had swollen up to about twice or 3 times the size, and Jay was completely calm. We were both panicked because we were actually getting married the next day. Of course, April Fool's Day, because we were fools in love. And we got into the ER, and Jay said, "Well, we're going to have to drain the knee. It'll be the first thing that we need to do. And if the fluid comes out clear and milky, we'll know that there's not any significant injury, and you'll probably be okay. If it comes out with some blood in it, we're going to have to probably send you somewhere to see somebody, because you probably have torn your ACL or done some other damage." And Jay gets the giant syringe and drains the knee and holds the tube up and says, "Looks like a fine Cabernet," and says, "Guess what? You probably tore your ACL." And at that point, I was just convinced that our plans to get married needed to be put aside, and that we needed to head back to Denver and go see an orthopedic surgeon. And Jay said, "Nah, you don't need to do that. You need to go ahead and get married. You're getting married tomorrow. No problem. I'll put Chris in a splint, and you'll be fine." And it turned out we're still married, some 20 years later.
Born in Philadelphia, Jay went to college in Lancaster, graduated from the Philadelphia College of Osteopathic Medicine, and completed a 16-month OBGYN residency in New Jersey. Then he traveled to Colorado and experienced the drama of mountain peaks, meadows, and wildlife. He was hooked, and against the advice of mentors, Jay moved his family to Denver, bought a medical practice in Gunnison, and went to work. He didn't stop working until 39 years later.
I was hired at Gunnison High School to be the assistant principal, and one of my very first tasks that was assigned to me was to call Dr. Jay Welkoff and get him to come over and do the sex talk. So I called him. He was great, and he said, "Absolutely, I've done it many times. I will come over and I'll do that for you." So he came over, introduced himself. I put him in the auditorium, and he pulled all the boys in, and I went to do something else, and I came back, and he actually had everyone leaning forward in their chair, and he was talking about what they were supposed to do with their penises. So it was a really interesting time and a moment in my life I will never forget. So he was great. He was great with the kids, and they appreciated him, and I think they learned a lot. It was good.
Everybody who knows Dr. J, I think, is a friend too. He didn't spend a lot of time away from practice, but when he did, it was always a friendly visit and cordial, and one of those things where you always felt welcome. Family practice. Not only did he take care of my wife and I, he delivered our kids, he took care of our kids. And in fact, delivering our kids, our first daughter was a little reluctant to come into the world, and he was getting, I think, a little frustrated or perplexed with how we're going to move this forward. And of course, I was there, and I'm sure I was under his feet. And so he was very creative. He said, "Hey, you're a paramedic in the Army. We need to use the anesthesia machine. The anesthesiologist's not around. Put it together." And so I think he found a very effective tool for getting me out of his hair and putting me to work. And of course, we were both smart enough to know that you should never use an anesthesia machine that I put together. But our daughter was delivered successfully, and life went on, and it was just wonderful. Then a few years later, when our second daughter arrived, he was a few minutes late arriving at the hospital, and I very nearly had to deliver her myself. And having been a medic, it wouldn't have been totally unfamiliar, but of course, being my own daughter and my own wife, I was terrified. But he arrived, and everything was smooth and went well, and of course, his usual calm manner and his confidence and his demeanor just were absolutely perfect, and made the day.
I met Dr. Wolkov in 1991. I was pregnant, and the doctor that I was seeing at the time left the Valley, and so I needed to find a new doctor to deliver my baby. So I decided I would go ahead and meet Dr. Wolkov since he was in the same office. And I can still remember him coming in that day, and he says, "Hi, I'm Dr. J. Wolkov. You can just call me Dr. J. I delivered about 250 babies for 6 months of my OB residency." And I just thought, okay, you can deliver my baby. And so that was my first meeting with him. And it was about 2 years later that I came into the office with my son, and they were like, "Hey, do you want a job?" And I was working up in Crested Butte at the time, and so I was like, sure, that was great because it was more comfortable for me to be down here with my son in daycare and everything. So that was when I started working for him, was in 1993. So I worked for him for 20 years and got quite the education over the 20 years. It's been a very interesting, never dull ride. So I was very grateful that they gave me the opportunity to, to work in the clinic, and he was great about always explaining things, and it was great to see all the students that came in. He was always willing to teach you things, always had a story for everything. Even the patients, when they would come out, they would be like, "Oh, yeah, I got to hear another story today," And I think of, like in most of our office meetings when we got together all as a group, one of the biggest things that he would always say is, "I'm a person just like you guys. I put my pants on the same as you guys, one leg at a time. I can't run this office without you guys. I can't do what I do best without you guys doing the rest." So he was always great about, showing us as a team, and that he knew he couldn't do it without us, and we couldn't do it without him.
So we've known Jay for a long time. He's been certainly a great doctor for me, and very attentive to my needs, and very much served what my medical requests and needs were. And sometimes that was on a more informal basis at times when appropriate, and he's always been very accessible to me. Also, although wasn't always officially the team doctor at Western during my time there, because he was my primary care physician, and during my coaching days, which I was the head wrestling coach from '85 to '97, I used him a lot for our athletes with physicals, but just to make sure that they got in a timely manner and were assessed. In intercollegiate athletics, you want the health and safety of the student athlete to be paramount, but you want that diagnosis, steps to recovery, and back into action as quick as possible, and at least diagnosis so that you can make other decisions about backups and different things in that world moving pretty fast, and dealing with student athletes in a competitive schedule. And Dr. Wolkov was always really responsive to that, and that was always greatly appreciated. In particular, in that particular sport, wrestling gets skin infections and some of those kind of things at times, and some physicians aren't always as familiar with them or as aggressive in knowing how to deal with them, and knowing the serious level of what can happen and get an entire team wiped out with that in a fairly short amount of time. It was always very appreciative that we could get Dr. Wolkov involved and really snuff that out in the times when we had that. So in meeting those kind of needs, both for me personally as well as my student athletes, when I coached for those 12 years, it was always very appreciated and very refreshing, and I had good confidence levels on what was happening to allow us to operate in the world we were operating in. And I think a lot of that came from his experience as a competitive collegiate swimmer.
I met Jay Wolkov soon after he came to Gunnison. He wasn't my doctor originally. Dr. John Armstrong was. But then Dr. Armstrong left and became an anesthesiologist, which he currently is today. And Dr. Wolkoff became my doctor. Very intelligent guy. A guy has had many activities. Last year I had an opportunity to take Jay and Patsy and a couple of other people through the Gunnison country. And I was astounded at how much Jay knew about the area and how well read he is. He's a real intelligent guy, and I really respect that and appreciate that. And he's very interesting to talk with because, as you said, he's got a lot of stories, and they are all pretty specific and to the point. You know, I think the greatest contribution of Dr. Wolkoff is that here he is in a county that's got 14,000 plus people. It's a very small town, the town of Gunnison, Crested Butte a little smaller, and you get tremendous high quality medical care, not only from Dr. Wolkoff, but some of the other doctors also, or all of the other doctors also. But Jay is kind of special. He's been around a long time. He knows the people. He knows your past history. He knows you well. So he's able to give great medical advice, and I think that's been his great contribution, is high quality medical advice in a small town.
Over the years, Dr. J became a driving force for healthcare in the valley. He served on the hospital medical staff, delivered 1,400 babies, took shifts in the ER, and helped open the Lake City Medical Center. He drove through midnight snowstorms to stitch up cuts and even delivered a baby in a teepee.
Well, I met him probably my first day of work. I don't remember exactly when it was, but and we worked together for 29 years. I actually lived right across the road from him for a while, and our kids grew up together, and so it wasn't just a work, you know, I mean, we still had, you know, other things in common, and we delivered many, many babies together. I just think it was the continuity. He loved doing labor and delivery. He really did. And this probably shouldn't be in the thing, but I remember this was probably one of the first times I met Jay. As a doctor, I was doing a delivery, and I happened to live across, we had just moved across the road from him. And he lived about 7 miles out. And I remember him telling the mother, you know, don't worry, if anything comes up or anything, Joni will call me and I can be here in 5 minutes. And I remember thinking, oh my gosh, I gotta call my husband and get the kids out of the road. Because if he can be here in 5 minutes, you know, and he was. I mean, he probably was stopped by the highway patrolman more than anybody because he'd always he'd rush in, but he was always there for his patients. They could call him anytime. He had a vested interest in him especially when he delivered them. It was very vested, you know, and I was sad when he stopped doing deliveries, and I think he was too. I think it was a real bittersweet time for him to stop doing that, and I don't know, I guess it's just that he liked the continuation of the care. What some of us older nurses, what we remember, we always think of him coming in the winter, and he had this big old orange ski jacket with this funny looking stocking cap. And he wore that, I think, let's see, out of the 29 years, I think only 3 years that he didn't have that. And we would look at him and just go, oh my gosh. I mean, it was hunter orange, you know, and that's what we kind of remember about him. But he would just always sit and tell us stories.
I'd always had an interest in medicine, and my former wife and myself took the EMT class 30 plus odd years ago, and Dr. J was one of our instructors. He continued to do that for years. He was especially fond of doing the obstetrics and childbirth portion of the module. He's always been a great educator, and it's always amazed me at the passion and enthusiasm he has for medicine and for education thereof. There's been many, many students that we've had, medical students and residents that have come through. A lot of local people in the community. He has steered toward a career in medicine. He's always been so enthusiastic, and as I said, such a great educator, willing to spend the time and explaining things to you. And I think that's one of the things I admire about him the most. He really helped me with a lot of things like that too, so that was really appreciated. Back in, I believe it was in the 1970s, when home births were still quite uncommon, and he did have a couple that was planning a home birth. And he had an old Scout that he had, and he probably packed more medical equipment in the back of that Scout to take to them because they were living in a teepee to do a home birth. And everything went well, everybody was happy, but I think that was probably a long, uncomfortable night for Jay. But as I said, the outcome was great. He still likes to relate that story a lot about doing the home birth in the teepee. So that was one of his favorite stories that he's passed on to us as well.
Jay became our family doctor in 1984, and our daughters were 7th grade and I don't know, it must have been 4th grade. I've lost track. And he remained our family doctor until his retirement. So that was the primary context of my interaction with Jay, was through his medical practice and being a patient, and all of our family being patients. I did interact with him on a couple of other levels as a county commissioner for a good part of my commissioning career, a couple of terms. He was the county health official, and we didn't interact in terms of seeing a lot of each other, but we had monthly Board of Health because the commissioners meet as Board of Health, and he would attend those, and then he was a hospital spokesman and on many occasions because the commissioners appointed the hospital Board of Trustees. And so we interacted on that basis as well. So that was a professional relationship, but very different than a patient-doctor relationship. And then I saw Jay frequently at Art Center functions. One of my main commitments to Gunnison over the years has been being active in the Art Center in various capacities. And so I've spent a lot of time at various events there. And Jay was always a pretty constant force there in terms of supporting events and activities that went on there, so we interacted in that way as well. I think most people live here by choice. Gunnison is not a place that you necessarily just happen on. It has some challenging features to it, climate being one of them, isolation geographically being another. And so people choose to live here, but as a result of that, that's both probably a challenge and a strength. The people that we do attract are pretty dedicated to this area, pretty dedicated to this lifestyle, and I think that Jay is one of those individuals. We also, as a result of those characteristics of our community, even though it's small in terms of population mass, we have a disproportionately high number of very highly qualified, very well educated, dedicated people, and Jay certainly fits that bill too. So I think that the fact that we have an unusually strong medical community to benefit our small community bespeaks of not only the type of individual that the Jay Wolkoffs of the world are, but also the nature of this strange place that we call home, strange in many ways, I guess.
The first week I came to Gunnison, I was fortunate to be able to attend the Chamber annual dinner, and I had dinner with Patsy and Jay that evening. And at that dinner, I can remember Jay saying to me that he had attended Upper Darby High School. He knew I was from Philadelphia. Upper Darby High School is just outside of Philadelphia. It turns out that my wife went to Upper Darby High School. Well, we immediately had a very... Jay, I'd also just like to mention to you, it's been an incredible year. One where I accomplished a lot with you and your patients. And I also, if anybody doesn't know this about Jay, he's also very direct. And I can say I appreciated that. Well, maybe not all the time, but I will say that it made me better in being able to manage Gunnison Valley Health, and I think it made Gunnison Valley Health much better.
You cared so much about your patients, and I've heard this testimony from various people, but how you would call professionals from out of town to continue or make a further diagnosis or to take care of a person's needs, medical needs outside the community, and how you did that very judiciously. And actually, Todd decided he wanted to be a doctor. He shared a house with Jay's stepsons, Chris and Ryan. So that was, it added to the conversation that we had when we would come together and talk about what they were doing, and as a group of men and young men, and so it was, something else that added to that aspect of him being more than just a physician. So Todd decided he wanted to change directions in his life, and he announced that he was applying to medical school. So Dr. J said, "Well, I can help him get into medical school. I can write letters, on his own." He solicited that. So that was really an additional aspect to that relationship that was more than a doctor-patient or a physician-patient relationship. And so, so each time, as I say, each time that we had an appointment with him, it was more, it was as much social as it was, medical. And so I arranged my last physical with him. I think it was 3 days before he actually retired. And it was a wonderful time of sharing about our life and how it had interconnected, and so I wish you well, Jay, in your retirement. I hope it's happy, rewarding. You've served our community for almost 40 years, and done it wonderfully and with great professionalism. So thank you. You're one of a kind. We appreciate what you've done for our community and families.
When Jay Wolkoff began his decades of service, the county only had 9,300 residents. It was rural, rugged, and a little wild. A setting that would intimidate most new doctors, but Dr. J saw it as an opportunity. And because he heeded that call of the mountains as well as the call of medicine, Jay Wolkoff helped an entire community thrive in this very special place. Tonight we honor Dr. Jay Wolkoff and celebrate 4 generations of care for our community.